The wrist is one of the most complex joints in the body. It is articulated to many different bones and has a wide variety of movement. Most people think of the wrist as the part of the forearm where a wristwatch is worn. However, the true wrist is known as the carpus and is made up of 8 bones. The wrist is a body part that articulates the proximal metacarpal bones of the hand to the distal bones of the forearm, the ulna, and the radius. The carpus is composed of 8 carpal bones arranged in 2 irregular rows of 4. These bones are articulated by ligaments which allow for gliding movements between the bones. Gliding movements are non-axial, meaning they only move side to side and not on an axis. Because of these movements, the articulations between the wrist bones are known as gliding joints. The proximal row of carpal bones, specifically the lunate and the scaphoid, connect with the radius and the ulna. The triquetrum is situated beneath the pisiform and forms the carpal arch where the carpal tunnel lies within. The distal row of carpal bones, the hamate, the capitate, the trapezoid, and the trapezium, connect with the metacarpal bones proximally. The ends of the metacarpal bones of the hands are covered with articular cartilage which helps with movement as well. The bones of the carpus may be known by a mnemonic, "Sally left the party to take Carmen home." The first letter in each word in the mnemonic is also the first letter in each of the names of the carpal bones. The mnemonic starts with the proximal row from lateral to medial, scaphoid, lunate, triquetrum, and pisiform, and then on the distal row from lateral to medial, trapezium, trapezoid, capitate, and hamate. The name of each individual carpal bone is named for its shape. The scaphoid is the largest bone on the proximal row of the carpus and is boat-shaped. It has a tubercle located on its lateral side where the styloid process of the radius articulates. It also has a groove on its proximal end, which is where the flexor carpi radialis articulates. The lunate is shaped like a half moon and is concave proximally where it articulates with the radius. Its lateral surface has a facet where it articulates with the scaphoid. The triquetrum articulates to the lunate medially, and the distal surface is concave and is articulated with the capitate and the hamate. The triquetrum looks like a pyramid. Proximally, it is convex and is attached to the ulnar ligament, and distally it is concave and articulates with the hamate. On its distal palmar surface, the triquetrum has an oval facet for articulation with the pisiform. The pisiform is a pea-shaped bone and lies on top of the triquetrum. Anatomically, the pisiform is located in the proximal row of carpal bones. However, it does not articulate with the radius or the metacarpals. The pisiform is a sesamoid bone which functions solely in the movement of the arm by increasing the rotary force of the flexor carpi ulnaris muscle which runs over the pisiform. Trapezium means little tube and has a crest and a groove anteriorly where it articulates with the proximal end of the first metacarpal bone. The proximal surface of the trapezium, articulated medially with the trapezoid, forms a concave surface where it articulates with the scaphoid. Trapezoid means four-sided and resembles a cube. It is articulated with the capitate medially and to the trapezium laterally. The trapezoid articulates with the proximal end of the second metacarpal. The capitate is head-shaped and is the largest carpal bone, which articulates with the proximal end of the third metacarpal, and a small angle allows for articulation with the fourth metacarpal as well. The lateral border of the capitate articulates with the second metacarpal, and the medial border articulates with the hamate. Finally, the hamate is hooked or wedge-shaped and articulates with the proximal ends of the fourth and fifth metacarpals. The medial surface of the hamate is articulated with the triquetrum. Only the scaphoid and the lunate bones articulate with the radius to form the wrist, as it is commonly known. The wrist is associated with muscles of the forearm that are responsible for the movement of the wrist. The flexor carpi ulnaris insertion site is on the pisiform, and the hook of the hamate, and the fifth metacarpal. This muscle is responsible for flexing the hand at the wrist. The groove for the muscle flexi carpi radialis is located at the proximal end of the scaphoid bone, as mentioned before. The flexor and extensor carpi ulnaris and radialis are responsible for the flexion and extension and for the adduction and abduction of the carpus. The gliding movements between the carpal bones allow for these movements. The scaphoid is the most frequently fractured carpal bone. A fall on an outstretched hand can put a lot of stress on the scaphoid and cause it to fracture. However, the diagnosis of a scaphoid fracture can be difficult because they do not all show up on x-rays. Healing time is about 8 to 12 weeks and usually involves a cast and, in rare cases, surgery. The carpal bones are connected together by ligaments and form a narrow space inside the wrist known as the carpal tunnel. Muscles and long flexor tendons running from the forearm to the fingers pass through this space. The median nerve also runs through this tunnel and is responsible for nerve supply in the lateral half of the hand. If inflammation in the surrounding tissues of the carpal tunnel occurs, the median nerve is compressed. Median nerve impairment can cause tingling or numbness of the lateral hand. For many people, pain is worse at night. Median nerve impairment is also known as the carpal tunnel syndrome and occurs in many workers who repeatedly flex their wrists and fingers. Workers who use electric tools that vibrate, such as construction workers, are especially prone to this condition. Treatment options include splinting or wearing a brace, medications to help with the associated pain, or cortisone injections to help reduce inflammation. If the previously mentioned treatment options fail, surgery is needed. Open surgery may be performed through one incision in the palm. Endoscopic surgery is another option in which a small camera is passed through an incision in the palm, which guides the surgeon during the procedure.